everyone. Welcome to Winning Wednesday. We do this every Wednesday. I love it. It's the best way for me to keep motivated during the week. It's not easy on this journey to passing NCLEX, but if you're a nursing student and you intend to be a nurse in the United States, you got to pass NCLEX. You got to pass NCLEX. And it's not just that this is the biggest test you will take in your life. It kind of is. But what's more important is that thousands of people have passed this test and you can too. Okay. Everybody's journey looks different. The one thing that matters is that you make it to the end. So we're studying quick facts for NCLEX. If you don't have this book, what are you waiting for? You need to have it because it is going to give you everything that you need in this little tiny package. But when you open it up, bam, filled with good information. You can see kind of my notes in here already. If you are a kinetic learner, if you're a visual learner, the best thing for you to be able to see are charts like these because they help you make connections. They help you make connections. And so all of the back of Quick Facts is pharmacology. If you struggle with pharmacology, this is the thing that will bring you out of the deep, okay? The deep of trying to remember everything in a drug book. So we're doing corticosteroids today. This is pharmacology topics, and I'm not going to read you this book. I'm not going to read the book to you, but I do want to draw out certain points. Let me know if I'm talking to future RNs or future PNs. Who do I have in the house reviewing corticosteroids, future RNs or future PNs? And if you know that you need remediation, like what we're about to do, you absolutely can get remediation. I want to tell you this. You can start remediation by clicking on my link and signing up for a free trial of the V2, a free trial of the V2. This counts as a remediation course. I just sent off a notice to the Virgin Islands, U.S. Virgin Islands Board of Nursing accepts the ReMar V2 as a remediation course. So if you need remediation, this is the place to start. Practical nurses, I see you in the house. I see you. Class is starting. That's what that bell means. Okay. We have talked about chronic renal failure in our last class, and today we are going into corticosteroids. Now, I want to just start from the top because there's so much that you can know just by looking at the actual name of a thing, name of a medication. So when you see the word cortico, because we're talking about corticosteroids, what does that cortical mean? What cortex are we talking about? Give me the cortex that corticosteroids are involved in. It's very important for you to know this. Which cortex? Which cortex? Is it in the brain? Where is it? Okay. We are talking about, do I see it yet? I don't see it yet. The adrenal cortex. The adrenal cortex. So corticosteroids are the adrenal cortex. Yes, very good, Becca. And then the steroid part, well, we know steroids are what? Steroids are hormones. So this particular medication is going to mimic what the body naturally produces. Now, when we talk about steroids for NCLEX, you have your glucocorticoids, your mineralocorticoids, right? Those are types of steroids. And so we're going to just briefly go over the importance of this corticosteroid class. I have here, what are the primary functions of corticosteroids? And the way that Quick Facts helps is that the question is on one side and then the answer is right on the other. So when we talk about why do we give a patient corticosteroids, well, the major part is to decrease what? It starts with the I. Corticosteroids decrease what? They decrease inflammation. Okay. Now, this is important because corticosteroids don't cure inflammation, they decrease inflammation. And so, as a safe nurse, part of your job is to understand if we're giving corticosteroids, and this is why I want you guys to read the book because this is information that you must know. Okay. If we talk about decreasing inflammation for our patients, we're not talking about curing it. So if the patient stops taking the steroid, what's going to happen with that inflammation? It is going to do what? Because we are only suppressing it. So if they come off of the steroid, yes, if they come off the steroid, it's going to come back. It's going to be worse. And so we have to think about, if a patient starts this medication, are they on it for a long time or a short time? And that is where you get into the different classes of corticosteroids. So here in the book, you have short acting, long acting, intermediate. Okay, good job. I see the notes on there. So thinking about that, whether a patient's on this medication for a short time or a long time, how do we tell them to come off of this medication? What is the one thing that we tell them? And I see it in the comments already. You have to do what when you come off of a corticosteroid? Can you just wake up and say, I'm done? I'm done. I don't want to take it anymore. No, good job. So if you take it, you have to think of the other T, which is taper. So you take and then you taper off of this particular medication, because the patient will be worse. Now, I know you know that. I already know that you know that information. But what I want to challenge you on is actually what these corticosteroids do to the body. When a patient takes this medication orally, and I just want you to put in the comments, is the corticosteroid, how do I want to teach this? Let me do it for those of you who, there are certain things that must be monitored, right? There's certain things that must be monitored with corticosteroids. I'm not going to tell you the answer. I want you guys to teach this to yourselves, because you know this information. What is the major thing that is stress that must be monitored when a patient has corticosteroids ingestion? What goes up? What goes up? Okay. What is going to increase? The glucose, the blood sugar. Yes, that's a huge point. Huge point. Blood sugar is going to increase. Now, with that being said, let's start there, because I know there's other things that go and change and stuff too. We're going to talk about those other things, but let's start at the blood sugar level, because I want to just press you a little bit on this. If corticosteroids make the blood sugar go up, are the corticosteroid medications acting on the liver or the pancreas? Put it in the comments. If the blood sugar is going up, is this medication acting on the liver or the pancreas? Okay. This is why you come to class. This is why you come to class, okay? Because we want to take it a step deeper. The information has to be understood at a different level for NCLEX. It's not just about knowing answers, but it's about knowing the why behind the answers. So on Wednesdays, I do this. On Mondays, I do this. If you are studying for NCLEX at any level, you should be at this class. So I see the answers in the comments. I see them on Facebook. I see them on YouTube. I see them on TikTok. The correct answer is corticosteroids, because they are increasing the glucose level. They act on the liver. Remember that point, okay? They act on the liver. They're causing the liver to produce more glucose. If they were to act on the pancreas doesn't produce glucose. What does the pancreas do? Okay. This is where critical thinking comes in. The pancreas produces what? Not glucose. There you go. Pancreas is not going to make the blood sugar go up. The pancreas would make the blood glucose levels go down, because that would be producing the insulin. We're not seeing an increase in insulin. We're seeing an increase in glucose. Okay. So let me go on, because I'm not going to be on this class long here. All right. So we know that. Let's talk about some of the other changes that happen when you start taking corticosteroids. So I have here the potassium levels. The potassium levels go what? Up or down for a patient that is on a corticosteroid? Are they going to be increasing in the blood glucose levels or going down in the blood glucose levels? Potassium level, watch this, potassium level will decrease. It's the same with Cushing syndrome. Remember, Cushing syndrome patients have too much steroids. Their potassium level goes down. And because of that, what does the sodium level do? The sodium level goes what direction? When potassium goes down, sodium goes what? Sodium levels go high, go up. Yes. So there's an inverse relationship here. This is significant because we know that where sodium goes, what else follows sodium? What always follows salt? And then our patients have pain and they have what else? What is it? Water. Yes, our patients have swelling, they have pain, they have fluid overload. Absolutely. So remember, look here, look how we got here. This is remediation. I'm challenging you to find knowledge gaps. Because when we first started talking about corticosteroids, we were just talking about hormones. We were just talking about the adrenal cortex. And now we're all the way to fluid overload. And so you have essentially taken care of a patient. Okay. We're at the thinking part. So good for you guys. Okay. So we know glucose high, sodium high, fluid high, blood pressure what? Blood pressure high or low? Which one for this patient? Blood pressure is high. Blood pressure goes up too because you have fluid overload. So that blood pressure is going to be up. But we know that potassium will be low in this patient. Potassium will be low. And these symptoms also are going to reflect Cushing syndrome. Okay, let's talk about the wound healing of the patient. Patients with corticosteroids in their bodies, do they have fast wound healing or slow wound healing? Fast wound healing or slow wound healing? Okay, now you know that. Now, I just want somebody to tell me, why would the wound healing be slow? Why is the wound healing slow in patients with corticosteroid therapy? I'm on page 26 of the book. Okay. I'm not going to tell you this answer. I'm not going to tell you this answer. I want you to leave here with one question that is your homework question. Patients with corticosteroid therapy have delayed wound healing. But why? Why? This is for anybody who wants to be a nurse. You should know this because corticosteroids are actually quite common in the American healthcare system. Anybody could be put on a corticosteroid. A baby could be put on a corticosteroid, a preschooler, a middle schooler, a teenager, an adult. How many people here have taken corticosteroids? You were given a steroid for any level of a disease process. Anybody in here? Am I the only one? Sometimes I'll go in asking for a steroid. You know, when you get a bad illness, you get a bad viral infection and you can't seem to come out of it, man, a steroid will do you good. Yes, a steroid too, itching cream. That's a steroid. All right. So that's your homework. Why is that wound healing so slow? Okay. Why is that wound healing so slow? On the next page on 27, there are three classes of corticosteroids. There's short acting, there's intermediate acting, and then there's long acting. I am not going to go over each individual medication, but I do want you to know the general principles for why a patient is given a short acting corticosteroid. Okay. And so short acting are going to be for replacement. And when we say short acting, this doesn't mean that a patient will only take it for a short time. Okay. it means that when the medication is in the system, it does not stay long. So it's there and then it goes away. So when you're on a short acting corticosteroid, you're going to take it several times a day. Okay. That's what short acting means. And I think sometimes we're not really sure the context of that. So somebody who says, I use the cream on a rash, that's a short acting corticosteroid cream. You can put that on twice a day, 3 times a day. Okay. Intermediate acting is for our inflammatory conditions. Give me an example of a chronic inflammatory condition that an intermediate corticosteroid would be prescribed for. What is a chronic inflammatory condition that patients have that they would need steroids for? Okay. Asthma. Yeah. What else? What other things? Arthritis. Arthritis. Okay. Yeah. Arthritis. I didn't even have that one written. But I have that one written. Oh, I did have it written down. What else? What other autoimmune disorders? You guys brought out arthritis. Bronchitis. Yeah, but what bronchitis with COPD? Lupus. Lupus, yes. For cancer. For eczema, I think eczema would be a short acting. Yeah, lupus MS. Yep, I have that one. COPD, have that one. Okay, and so that's what the intermediate is for, those chronic inflammatory conditions. So not short acting, intermediate for those. Now, long acting are for the life-threatening conditions that patients need to have a steroid right now or they're going to expire. Okay, so think about it let's start with the little babies. The little babies, what do we give a long-acting corticosteroid for? What does that help them to do? I know you know this. Come on, I got to pull it out of you, but I know it's there. What is that condition that we're giving? Hey, and this is why I love our study sessions, and this is why I love having this time with you, because we get to go over stuff that you might not cover. Okay, what do we give little babies corticosteroids to do? We give little babies corticosteroids for their fetal lung maturity. Okay, and listen, y'all got to get this book if you don't know it. Yes, to mature the lungs. That's why we give newborns, premature babies, long-acting corticosteroids. Okay, so I said this is a medication that surely will be on NCLEX because you can give it to any age group, and that is one of the primary instances of medication administration for NCLEX. Can you give it to almost every age group? And if you can, you need to know about it. It's the same thing with a medication like digoxin. Digoxin can be given to any age. And so you must know about the principles of digoxin. Okay. All right. So life-threatening conditions like fetal lung maturity, also cerebral edema, those are things that will cause a patient to crash very quickly. And that's what you got to know on. All right. So now that you guys understand what corticosteroids do to the body and the appropriate time to give certain classes to them, you'll be able to read quick facts way easier. Okay, you'll be able to read this book way easier, and then you'll be able to also apply your knowledge to NCLEX questions and case studies. We're building our critical thinking, but the way you build critical thinking is through a review like this. Okay, and it does not matter to me. I know someone in here has been out of school for 5 years. Someone in here has been out of school for 5 years, and you may think, I don't know if I should go all the way back to nursing school, if I can even do this. And, but let me tell you, I want to reassure you, you don't have to go back to nursing school to pass NCLEX. You don't have to do that, but you do have to study. You do have to study curriculum that is appropriate, okay, to help you be able to think. You got to be able to think your way out of a paper bag, which I know you can do with this knowledge. All right, so coming to class is one of those things. I want to thank you so much for attending Winning Wednesday today. My goal is to allow you to see if you are studying according to your learning preference. And so if you enjoyed this lecture, you're more likely an audio visual learner. Okay. You're an audio visual learner if you really enjoyed it. But I always say most people are multimodal. So that means even if you have a strong preference for audio, you still benefit from having that physical book in your hand and reading it. So I will say goodbye to you now and have a wonderful Wednesday. Studying for NCLEX doesn't have to be long, but it does have to be effective. And you, at the end of every study session, should feel like you have gained some knowledge. So thank you, everyone.